What is weathering in the context of racism and health? What is weathering in the context of racism and health? This concept is vital for understanding how chronic stress from racism affects health, especially among people of color. Weathering refers to the cumulative toll on the body and mind due to ongoing exposure to social and economic stressors linked to racism. It highlights how these experiences can lead to premature aging and various health issues. When individuals face repeated instances of racial bias, it creates a constant state of stress. This stress is not occasional. It builds up over time and can lead to serious health problems. For example, people living in marginalized communities often deal with poverty and limited access to health care. These conditions can trigger physiological responses like chronic inflammation, which increases the risk of diseases such as hypertension, diabetes, and heart conditions. Research indicates that health disparities among different racial groups cannot solely be explained by income or education levels. The lived experience of racism itself plays a significant role in shaping health outcomes. Studies show that Black adults in the United States age biologically faster than their white peers, largely due to the stress of navigating a society that often discriminates against them. From an anthropological perspective, weathering illustrates how social structures and racial hierarchies impact health. It shows that social inequalities are not just abstract concepts, they manifest physically in people's bodies. This understanding is essential for addressing health disparities as it connects individual health issues to broader social injustices. Recognizing weathering also has practical implications for public health. It emphasizes the need to view racism as a social determinant of health. Public health initiatives should focus on reducing the chronic stress caused by racial discrimination. This means creating more equitable environments that alleviate these burdens. In essence, weathering in the context of racism and health explains how ongoing exposure to racism leads to accelerated aging and increased health risks among marginalized groups. This framework helps us understand health inequalities as reflections of social injustice and systemic discrimination, guiding efforts to address these critical issues.